ventilators. Second wave of COVID, we had what we needed. The vaccine was coming. We were managing the COVID patients, and we got hit with a huge number of regular non-COVID patients who were sick. And, so that was we were bursting at the seams, more non-COVID than COVID, because people had delayed care. So then the third wave that we just went through most recently was our people got sick, as well as the patients. Yeah. So then we had a high level of COVID patients, a high level of regular patients, and we had a limited number of staff, which is why you saw, and heard about the traveler agencies that were coming through and getting $200 an hour for nurses. And, it just was it has been a real challenge. I will tell you that, as we start to go through the slides, the most important thing in a crisis that we can do is do a couple things. One, continue to serve our community and reaffirm that we are here for people and that we want people to come back for care. And two, that we need to keep planning, right? We don't have the privilege of stopping to say, hey, this competitors are coming into our market that we've never seen before, right? Amazon now has clinics that they've set up. We see clinics in CVS. We see, the primary care office, that local doc that you trust is being replaced. And if you look at the demographics of those people who are using urgent care, what they, that 20 to 30 group is saying, look, I don't need a primary care doc. I go to urgent care. I'll just go, it doesn't matter to me who I see. I'm just going to have that relationship. So it really is an entire upheaval in how people access care and how they feel about their healthcare system. And so I think we're trying as best we can to adjust that. Marlene, if you just put up the slides, I'll jump right in unless you wanted to,
Well, I wanted to acknowledge Sam. It's actually Sam and Bill's meeting. So
I'm sorry.
That's all right. That's.
I was so excited by Sandy setting me up that I thought we were gonna go. So I'll stop. I apologize.
Well, we'll follow the agenda, which is in front of you. So Sam, I'll turn it over to you.
I don't know if I want to stop the flow right there. She was on a roll.
Right.
So geez, I hope I don't mess it up there. But anyway, good morning, everyone. Sam Donaldson. I'm with AECOM. Very happy that you all joined today. I want to just acknowledge that my co-chair of the Economic Development Committee, Bill Whalen of Ocean First Bank. So Bill, I saw you on earlier. Thanks for joining today. And as you know, this is a joint meeting between not only the Economic Development Committee, but also the Healthcare Committee for obvious reasons. So thank you to the Healthcare Committee folks for joining. Wanted to recognize the two co-chairs on that committee, Frank Jones of Mintz Insurance Agency and Kendria McWilliams of Maryville Addiction Treatment Center. So I know I saw Frank. I didn't thank you for everybody for joining. You can see on the agenda, we were intending on doing self-introductions for all that are on. I think we're well above 40, probably closing in on 50 people. If we did that, Amy wouldn't have a chance to talk. So please look at the agenda. You can see who is here. Again, thank you for the great turnout. If you don't have the agenda, certainly Marlene and the staff can send that over to you so you can see who is participating today. So with that, at the risk of taking in more of Amy's time, I did want to go through a quick bio, just so you know who our distinguished speaker is here today, for any of those that don't know her. Amy Mansu is the president and chief executive officer of Inspira Health. She was appointed to that position in August of 2020. She has nearly 3 decades of service to the healthcare industry and has made significant impacts across the state, having worked in both politics and for leading hospitals in New Jersey. Even though you worked in politics, you still seem to have a very good sense of humor. So I guess you need that working in politics. In recognition of her experience, Amy was appointed regional coordinator in Central Jersey by Governor Murphy during the pandemic. And prior to her role in Inspira, she served as executive vice president and chief experience officer at RWJ Barnabas Health. She was also the former chief executive officer of Children's Specialized Hospital and the board chair for both the New Jersey Hospital Association and the New Jersey Chamber of Commerce. Amy earned both her bachelor's and master's degree in social welfare from the University of Alabama. So without further ado, I'll let you hear from Amy, the smart person on the screen right now. So Amy, thank you so much for joining us, and I'll turn it over to you.
Thank you so much. And again, I got so excited talking about COVID, I got well buried myself. So please excuse my
Not at all.
rashness. I apologize. So if you go to the next slide, I really want to affirm what I just said. First of all, we're so grateful to all of you for the support that you've given us. And as I arrived in August of 2020 in the middle of the pandemic, which I don't know if how that speaks about my career decisions come in the middle of a crisis, but it really was just too wonderful an opportunity with all of the commitment that our board has about really improving the health of our communities. Our primary service area is in Cumberland, Gloucester, and Salem. Of course, we have boundaries extend on every area. And for those of you who will go down the shore this summer, I'm sure you're going to see our Inspira trucks down there because we expanded our EMS fleets to respond to some of the community need that has arisen as well. In the fall of 2020, late into 2021, our board updated our strategic plan. And these are our 5 pillars of excellence with growth, quality, people, service, and financial being our drivers. We thought it was very important to stay focused, even in the middle of the crisis. As I said, the marketplace is not going to stand still for us. So we really have to ensure that we have the strong vision and continued desire to be able to meet those needs of the community and improve the health of the community. Around the quality goal, we have set a very extensive goal for ourselves of being in that top tier of quality hospitals in the country. And right now we're sort of in the middle of the pack, and we really want to be over that 75th percentile. On our people, we have some real challenges that we know are coming. If we did an analysis of all the physicians in our community, especially in Cumberland and Salem communities, we see that 1/3 of the physicians will be eligible to retire within the next 5 years, 1/3. So when you look at how we could really support the backfill of those desperate community needs, it really is going to talk a lot about our continued growth of our resident program, where we're training over 200 physicians each year to train at our hospitals within the Inspira system, but hopefully fall in love with South Jersey and stay here. We really have an active process of both hiring our own docs as well as encouraging them to seed within strong practices in the community to be able to better serve our community. In reference to service, we want to be able to distinguish ourselves in reference to our patient experience. We had a long history at Inspira of strong financial growth, and we know that that is continued, that allows us to get through these difficult times and to continue the expansion that we need to do. There will need to be investments made. And so the track record that we've had may not continue in the exact same way, but we know that without the margin, you have no mission. So that will continue to be a focus of ours. And of course, just the overall growth, which we'll spend a lot of time talking about that. We know that there's opportunity for us to continue to expand our footprint and also look, the first wave of growth really came from the acquisition of small practices, 1 and 2 physicians. So we will be working on identifying where the best locations are for those small practices and seeing if we can consolidate them. The opportunity for us to really make sure that we are providing that one-stop shopping really helps when you can congregate physicians in small areas. Most likely docs who've been working by themselves for a long time are not going to be excited about going into a group. So making sure that we've identified the right physicians who really want to do that. And that will be part of the process you're going to hear me talk about as we move forward. So if you go to our next slide, we do have in our growth pillar some ongoing plans that have are already underway. We have a new Deptford location, the old Dick's Sporting Goods on Almanesson Road, sort of catty corner from Adelphi is the best way I think about it. We are building a large facility which have about half a dozen medical services in there. We're going to do cardiac diagnostics and cardiac rehab there, physical and OT to go along with our cardiac program. There'll be an imaging center. We're offering primary care, OB, ortho, and then we're going to do timeshare for a variety of specialists who are looking to come in. And the Cooper Care Alliance will also be leasing space from us in that new Deptford location. You'll start to see the demolition as you go by. It's all fenced off. We're excited by that process. and are very anxious to get that underway. The town has been wonderful to work with, and we're so grateful of all the support that the mayor and the council have given us. I know that there'll be lots of questions about this slide, the next slide in reference to Woodbury. You know that we've been going through a process to make sure that we can support in the community the appropriate services that go on that program. Remember that when you move a hospital in New Jersey, you must keep a satellite emergency department on that space. And we also have 20 behavioral health beds there. And so in working with the state, we will be building a new satellite emergency department and a 20 bed behavioral health unit. You will also notice as you go down that road that we are already renovating our medical office building, which will continue to remain there. So our existing footprint, we did a request for questions to developers in May. We had 18 developers indicate that they had questions and had interest. From that, we responded to their questions, and the field has been narrowed to eight individuals or companies that will be continuing to move forward in the process, where obviously we will then work to narrow it down to one. Our goal is to have that process done by the end of the fall. Obviously, you know, while it certainly is our decision how we will move forward in reference to that campus, we'll be doing that in lockstep with the council and with the new mayor at that point. As part of that work, the city did ask us if we could move our EMS facility, which is really sort of as you walk in to Woodbury, it's right there on the main street. So we will be consolidating that into our satellite emergency department as well. And so all of our Inspira footprint will be in one location. You know, obviously the redevelopment, we had indicated that we would have preference over a developer that was going to be actually taking the building down. We did a lot of analysis before the move to Mullica Hill about what it would take to be able to expand that building and retro it. And we just believe that for all purposes, it would be best served for the community if that building actually is down. It doesn't mean that the 8 aren't going to put forward something that may actually have a renovation of that building, but there will be a much higher threshold in reference to the questions about how that would actually be executed on. I think, and many of us have been through one too many retrofits that actually end up falling apart after that deal is done, and we don't want that to be what remains in the city. So we'll continue that process, and we're very excited about that. And again, I'm looking forward to having that resolved, candidly. On the next slide, I'm sure that there are many of you that have heard that we are in the process of working with the existing owners of the Salem County Hospital, Salem Memorial Hospital, and in a nonprofit to a nonprofit, which is what this would be. We're looking at a member substitution, which means that that entity will remain the same, but it will sit under our board of directors at Inspira. So the existing owners submitted our application to this Attorney General in February of this year. There have been a series of questions that have gone back and forth. There have been no fewer than 4 times in the last 3 months that I was sure this was imminent and we're gonna get the approval right away. But I was wrong, so I'm not betting anymore on when that will be. Whenever the Attorney General's approval comes forward, we will have 10 days to close with the existing owners. And then from there, there's a public hearing process that's required by law that requires a 60-day public hearing. So you have 45 days to set the date and convene the hearing. The public is then encouraged to come forward, offer their advice. We already have community leaders that have committed to being on the ready whenever that clock starts. So I think we have it well in hand. We do not anticipate any issues, but I also know, and I'm sure there are people on this phone who have heard that there are many outstanding debts that are owed to existing vendors, and that has become an issue of much concern. I can't really go anywhere without somebody asking me what that process is going to be, and I've been assured by the existing owners that they will settle those debts before ownership is taken. So on the next slide, we have invested a significant amount of money in our facility in Vineland. We have done some renovations, just some facelift renovations in the lobby, which looks beautiful. The last little ad is that the coffee bar will be going in, and staff are very, very excited about that. And we are kicking off a cardiac campaign. The legislature approved the ability for all hospitals to apply, if they're qualified, to do what they call elective PCI, which really is a cardiac cath. It means that if you come in and you're in need of a cardiac procedure, before we could only do them emergently in the Inspira facility. So, and other facilities throughout the state. And so now we have applied to be able to do elective PCIs. We have an existing relationship with Cooper and are called our cardiac partner relationship, where we send the high-end work to Cooper. And we now, when we built Mullica Hill, we anticipated, or hopefully anticipated, that this would happen. And so we had all of the renovations needed. So Mullica Hill went live with elective PCI in January. We have done 60 of those procedures already. And Inspira has just received approval as of this week, as of the renovations that we've recently done, to be able to do elective PCI. And I understand that we have elective PCIs already scheduled for today. So we're very excited about that. Excited about having this service in our community. Wonderful for our community members to be able to stay here and get that service. And of course, we already have the existing relationship with Cooper, that if they needed a higher level of care, we have that easy transfer back and forth, and the doctors all work together. The next slide is our endoscopy center. We have also just received approval for that. All of these have been in process. And so the medical office building, which sits on the Vineland campus, for those of you who know, it's old Suite G downstairs from the existing endoscopy program. Has all been done. It's beautiful. We're very excited. We have 4 docs. Dr. Shields, who I know many of you know, he's a legend, has been with us. And then Dr. Coper, recruited Dr. Sarah Atala from Penn, who's just a superstar, and as well as Dr. Natasha Shaw. So we're very excited to be able to give them this beautiful new space and be able to provide this expanded service for our community. Many of you may know, the next slide talks about a program which is referred to as the PACE program. We've named it our LIFE program. It really stands for a program for those individuals who are eligible for both nursing home care, but they want to remain in their own home. And many of us know, we have people in our lives who we're trying to keep at home, and how difficult that is to be able to manage your parents if you don't have the supports necessary. And so this program actually provides the opportunity for those patients to be brought in to a program every single day. It's different than an adult daycare program, because it actually has medical services on site. So we have doctors and nurses, and we have clinics that can actually continue to watch and monitor patients on a daily basis. So we can see those changes and trends. And I have to say, the team has done such an amazing job. During COVID, obviously the Life Center couldn't be open. And so we had to pivot to be able to move all those services into people's home and be able to monitor them at home and keep them safely at home. And it really was a huge undertaking for the team. They did a wonderful job with it. And we actually, our Director of Quality, Alasia Powell, is going to be honored by the Hospital Association with an award for innovation at their July meeting, because of the way that they were able to restructure the program and be able to keep those individuals safe. And obviously the program is now back open. We also have expanded, however, and are waiting anxiously to receive approval in Williamstown, where the new Life facility will be on Black Horse Pike. And really think we expect that approval sometime in July. We're anxious to be able to serve that part of the county and to be able to provide that service. Our existing program is in Vineland right now, right off Sherman Road. Lastly, next to last, I guess, we had opened a Woolwich, in Woolwich, an urgent care center, as well as a primary care center. It is booming. We were just waiting for final approvals on the imaging program as well as the sleep program, and we just received those 2 weeks ago. So now all those services are open now. Axiom provides OB services there. We are so excited that they have moved in. They moved in there in August. So it is up, it's running, it's packed, and we are very happy to be able to provide these services in Woolwich. The next discussion is what I started with, which is really how we're going to grow our physicians. So really trying to, the way the process works is a hospital can apply to an organization called the ACGME. It basically is the accreditation body that allows you to train the future doctors. And you have a 5-year window from the moment they say yes to be able to set up your residency program. We've had a residency program in our facility in Vineland for over a decade. And we have done a great job of training probably about 169 docs in those slots and across 11 specialty areas. And so many of those physicians we've been able to keep here and allow to train here and succeed. Actually, one of the surgeons that trained with us went off to specialist work as in bariatrics and then came back. He's doing both general surgery and bariatrics with us, Dr. Christopher Bashian. He's from Gloucester County. He grew up here. He wanted to return here, wanted to be here. So he works out at Elmer and Mullica Hill, and we're just so excited. And we think that that's really the future of the program, is to have people either who live here and grew up here, who are training to be doctors, do their residency here and then come back, or that we recruit them from other parts of the country and they stay. We do know, however, that those individuals that already have family ties here have a much higher likelihood of remaining in the community. So with our partners at Rowan, our partners at the Philadelphia College of Osteopathic Medicine, we have prioritized those individuals from this area to be able to come and use our residency program and train with us when we're accepting residents. And that prioritization, I think, has gone a long way to really making sure that we could keep people here and keep them to be able to have this expertise within our community. The lovely young woman you're looking at grew up in Mullica Hill. She's an OB resident, and I'm thrilled to say that she's in her 2nd year, and she's just signed on to be with Inspira and stay with us when she completes her 3rd year of training. And that really is the example of what we're really trying to do with this residency program. We have one of the largest teaching programs in the state of New Jersey. By the time we're done in Mullica Hill, we'll be over 230 residents across our entire health system. And we think that that's a wonderful example of the commitment we're trying to make to the community as we improve the health of the community. And lastly, before I start taking questions, I wanted to tell you about this wonderful program that we've created. So as you can imagine, the pandemic has hit the county colleges tremendously across the state, across the country. And every county college is really struggling with enrollment. We in the healthcare industry are reaching a time where you've heard about the great resignation of all of the individuals who were at that precipice where they could, move to retirement or just say, you know what, I'm out. I don't want to do this anymore. And so as we saw the confluence of the challenges that we were having in reference to, some of those individuals making those decisions and making those life decisions, and our local partner, Rowan College of South Jersey, who's been a longstanding partner with Inspira, we sat down with Dr. Keating and said, look, isn't there some way we can work together? We also understand that we have an obligation as one of the largest employers in Cumberland County that is not associated with government. We have some challenges in Cumberland County. We have one of the worst health outcomes in the state of New Jersey, is ranked by the Robert Wood Johnson Foundation. We have the lowest graduation rate from high school across the state of New Jersey, in the county, across the county. And so those two things together made us really start to think about, and sitting with Dr. Keating, is there something we could do together that would help both of us manage through this global pandemic? And so what we came up with was that Inspira committed an investment into Rowan to create programming. And in exchange, there would be a reduced fee for our employees. If you're employed by Inspira, you already receive tuition reimbursement for any of your education programs that you want to go through. And we then work with Rowan College of South Jersey to say, okay, at a reduced fee, is it possible for us to figure out a way that we could really together, combined with the new the Garden State Guarantee, which is yet another program to supplement tuition, that we could say to an employee, look, if you work in Inspira, we'll pay for your, basically pay for your college tuition if you go to Rowan College of South Jersey. And then we now are working with Rowan University to say, how do we work on that fourth year? Is there something similar we could do there? It's much more difficult, obviously, at the university on the fourth year to say you'll cover all of it, but if we can at least get the majority of it, then we really have a pathway for people to continue their education. And this is not just in nursing. While we're investing the dollars in programming around healthcare services, the truth of the matter is we really are looking for anybody who wants to go back and continue their career. We understand that when you work in an area of poverty, you need to create good jobs and you need to create the academics that allow people to have the skills to be able to earn those jobs. And so for our investment and then a commitment to be with Inspira for 3 years, we'll basically pay for your college. And I'm very excited about this. We had a per diem employee that's been with us a long time, over 20 years, and our existing tuition reimbursement couldn't cover all of what she did for tuition, and so she stopped going to school. And when we announced this program, she came back to us and she said, you know, I'm going to do this now. I'm going to get my degree, and we know it's going to be life-changing for her. She's going to be able to move from a tech position to an RN position, and and that will change the world for her family. And so one at a time, that is our commitment, and that's our commitment to our people. And we believe that this helps the county college continue to make sure that people are there and going to school. It helps us by ensuring that we are doing the things that we need to do to be able to move forward. And so I'm very, very excited about that. And I was also very proud to be at the Rutgers nursing graduation when one of our colleagues received her DNP and was the speaker at nursing. And so we do provide the opportunity for the nurse practitioner residency as well. I know there's one other question in the chat, but I think I've gone through all my slides, and I will take a breath and be willing to open up and answer more questions if there are any. The question on geriatrics, specifically in Deptford. We do not have a geriatrician scheduled per se, but it is something we've been recruiting for and continue to recruit for. Geriatrics is one of those specialties that is very, very hard to fill. It's difficult in reference to reimbursement, that, you know, it's a sort of a lost leader, if you will. And many of those docs, while in high in demand, really have to go into sort of the specialty work to be able to support the reimbursement needed to cover all of the cost of the geriatric program. So we'll continue to look at that. We have been, I do know that geriatric nurse practitioners are starting to grow, and so that may be a solution to sort of partner with primary care. But right now, it's just primary care that we have slated for that. Okay, Sam, I'll take a breath, and if people have questions for me, I'm glad to.
Yeah, that sounds great. That was a great overview. Thanks so much. Any other questions? If you can put it in the chat, or you could unmute yourself. I see a hand up there, Dr. Brian.
Yeah.
Hi, good morning. As you think about supporting the population around you, the community around you with potential, you know, returning to work or being trained, I would encourage, and you're probably already thinking about this, looking at their social determinants of health and supporting them too, because I have a fair amount of experience in Camden walking alongside young people, and the biggest barriers are childcare, transportation, stable housing, that kind of thing. So it would go a long way.
Yeah, Dr. Brian, I have learned of the tremendous work you have done in making sure that the people of Camden had, and your students did, to make sure that the people of Camden had access to vaccines. And we're really so grateful, because you really were out there literally on the streets, making sure people got what they needed. Yeah, look, I mean, here's the truth of the matter. You know, there are our own employees, right? We find that that live on that precipice. And one of the things that we've done as an employer, we had a requirement that you had to have a high school degree in order to apply. And we've removed that now. As long as they commit to being in a GED program, then we'll work with them and provide support to them to be able to get that GED and then be able to move forward. And I think that's yet another example of things that employees are going to have to do. But the social determinants of health are very real, and how we begin to look at them. We've made investments in our community with both our food pharmacies, which literally exist within our hospitals. So if we find that there's somebody who is in a situation where there is an issue about having access to food, we literally, the pharmacist can go down and take the food out and give it to them and send them home with it. And then we can get them associated with WIC or the other programs within or SNAP, sorry, I'm dating myself, the SNAP program and the other programs to be able to move forward. But it is a very real issue for sure. And transportation, especially in our communities, continues to be a real challenge.
Thank you.
Sure.
I will see your hands up, Connor Strong.
Yeah, hi, Amy. Great presentation. It's wonderful seeing the new facilities, and they look nice and clean and disinfected and ready for being populated. Just when you showed the one slide with the facility in Woodbury and the inpatient, I guess, mental health facility there with 20 beds, I just was curious as to whether the state mandates a certain percentage or a certain number of beds for population or that type of thing. How is that determined?
Sure. So the state has what they call a certificate of need process that determines when you can establish an inpatient services generally, but specifically in this situation for mental health beds. There's also a requirement that you have to have an existing program or existing licensed program before you can move existing beds to another place. We worked very hard with the state to be able to move those mental health beds and expand under a previous CN that we had received approval on. And it's a whole long complicated story that has lots of litigation, but the long story short is we have an existing CN that we have 57 mental health beds that we could implement. Because they weren't built yet, because we knew we were moving the facility and we wanted to build them in Woodbury. We couldn't get approval to build those 57. So long story short, there's going to have to be some machinations of, ultimately I would like to have a much larger unit. Staffing a 20-bed unit is very, very difficult to do. And we're landlocked in Woodbury. And so, eventually I'd love to be able to build a freestanding mental health program that we can then, expand to. And, behavioral health is the #1 issue coming out of COVID that we have to deal with. And so,
Right.
But, there are processes that have to happen.
Okay.
But I had 20 existing beds there, so I had to leave them there.
Right. And the other question that I have, you gave a great update on COVID. And I guess about a month ago, this issue of monkeypox all of a sudden reared its ugly head. And I'm reading more about it all the time. Is that really a thing? And how's that? Are you folks gearing up for an epidemic in monkeypox?
It is really a thing. We do have confirmed in New Jersey our first cases of monkeypox. We don't have them down in South Jersey yet, but we will. I mean, there's no way, it's a communicable virus. It's going to happen. We are a global world right now, where if you've got it in one place, the likelihood of you being able to keep it there is very slim, especially with Newark and Philly being major hubs. So we have not seen it yet. We are prepared. You treat it like any other infectious disease. The thing about monkeypox is there's really not much you can do for it, right? The biggest issue in monkeypox is you've got to be able to test the people around that have been exposed. And right now, the process for that is, and I'll take a peer check from Dr. Bryan, but right now the process for that is that they get the smallpox vaccine, which can cause great illness or great reactions in adults when you do it. So, it's gonna, just like everything else in this world right now, it's complicated, right? So it's more on the outpatient issue than it is on the inpatient issue, but it has almost greater implications in reference to treatment for those that have been around them exposed and not sick than the person who's sick.
Thank you very much. Thank you very
No
much.
problem.
The most informative. Appreciate it.
Good question.
All right, Sandy, no hard questions.
Sandy, I see your hand up, but in the chat first. So we had a question from Howard asking, Howard, I'm sorry, I don't have your last name, but does Inspira plan on expanding EMS services, including in Salem County?
Yeah, so let's just talk a little bit about how EMS services how they happen, right? They're either dedicated already by to be operated by county or by an individual community. We can't just go in and do that. We've tried to be responsive to communities who've come to us. The requirements to actually be certified as an EMT, to keep all your trainings up, to be able to meet all those standards are much more significant than they ever used to be. And so we have had communities come to us and ask us to either fill out an RFP or come in and give them a contract for EMS services. The reason I'm hesitating is no one in Salem County has asked us to come forward and make application. This EMS is a very sensitive topic. So I want to be very clear about that. So right now, we do not have plans to expand into Salem County unless somebody wants us there. And then, of course, we'll entertain those conversations.
Understood. Very good. And Sandy, over to you for your question.
I made the mistake of saying, sure, I'll do whatever you want. And let me tell you, that boomeranged, right? I think that was like my first big misstep since I've been CEO. So I was very careful about my answer. Nobody's asked. We'll answer if they ask.
It was well phrased, very precise.
Oh, yeah, a lot of lawyer time there.
Amy, the land you own across the street in Vineland, I know, years ago, they were working on a plan. Is there any thoughts of what you're going to do with that, or is that still a future project?
You know what, Cindy, I don't know the answer to that. You know, we have existing space on the Vineland campus already. And so there are rules about how far you can go in order to get different kinds of reimbursements. So you used to be able to go across the street and it wouldn't matter. Now you can't. And so I don't know what our future plans are there, but we're holding on to it for now.
Okay.
Amy, I have one of my own questions. I'm a Salem County guy, me and the 18 other people who live in Salem County, as I like to joke. But so family members for generations have been going to Salem Memorial Hospital. You detailed some of the difficulties or just a protracted process here of that potential acquisition. Are there, and forgive me if you touched on it, but are there plans for improvements to the facility, expansions, stay status quo? Any further information you can share on that in that regard?
You know what, look, 5 owners in 10 years, 15 years, right? I mean, I think what I'd say to you is we need to get in there and take stock, right? Through the generosity of the Salem Health and Wellness Foundation, there have been tremendous investments, over $39 million worth of investment that is put into that existing facility now. And so you'll see the new behavioral health floors on 3 and 4 have been renovated, that they really look gorgeous. They're caring for people there. You'll see the outpatient space in the back. They've contracted with allies to date to set up outpatient behavioral health programs, and those are going well. The beautiful new ambulatory surgery center there that just got approved and opened, I believe, in October, as well as a medical office building that is fully leased and booked, and the docs are in. So there are assets that have been done with that $39 million. The challenge is many of their programs are at end of life, right? So their EMR is holding together with, Band-Aids and bubble gum right now. And, and the real investment would be on that second floor where the ICU is. And so I think we need to just get in there and see what's there and then be able to make some decisions about what the need is. We are looking at all 3 counties and trying to determine where best that ambulatory footprint that I talked about, all those primary care offices or really specialty care offices need to be positioned throughout the 3 counties. And so we will look at that. I know that the people who work at Salem are petrified that we're going to close it. The people in Elmer who work at Elmer are petrified we're going to close it. If you look at a map and you say there's 60,000 people here, the population is going down. Why do we need 2 hospitals? We should just smack them together and create 1 hospital. What I would tell you is that those individuals who live around Elmer will go no place else but Elmer. Absolutely none. They will not go to Mullica Hill. The people in Salem are driving by Elmer to go to Mullica Hill. And I can see that because I'm looking at the zip codes that are coming into Mullica Hill. So, and there's a whole group of people going across the river, spending the toll to go to Delaware, to Christiana, because the CEO of Christiana called me and said, hey, we believe in delivering service close to home, and it's not good for them to be coming across the bridge. So, can you step up and do something about this? So that's a long-winded way of saying, Sam, I don't know. We got so much to clean up. And not that they haven't done a great job, because they have, but it's just, when you're going through a sale, it's a really difficult process, and it's hard on the staff. It's hard on everybody. So we just got to really get in there and, first thing we need to do is assure the community that we want to be there, and we're committed to making sure that we work with them to figure out what people need, because, part of the challenge with Salem is people aren't going there. So what are those reasons? What do we need to do? It's not going to be just sticking a new name on it. There are things that we have to obviously address, or else it would already be busy.
You clearly have an excellent handle, all kidding aside. That summary you just gave is exactly what's been going on here for years. So I appreciate that. My mother in particular will go nowhere else but Elmer Hospital. Loves Elmer Hospital. Yeah.
And look, the people who work in Elmer grew up in Elmer. So you're really family caring for family. And let me tell you, when you show up on a night shift and you just try and do rounds, and you walk in and they're like, who are you? Why are you here? I mean, it's a very, they're wonderful and they're warm, but they take care of their own, and that's great. And you can see it. Elmer just received 4 stars from CMS, which is the federal government sets some companies, Leapfrog gives us letter grades. The federal government gives us a number of stars. There are only a handful of hospitals in the state that have 4 stars, and we're so proud that Elmer is one of them. And I think that speaks to the dedication of the staff and, candidly, the patients who continue to go there. But when I was in Trenton 25 years ago, and I was looking at maps, and I'm, as a health policy person, I'm like, there's no reason that there should be 2 hospitals. This is ridiculous. Now, I get it.
Well, as a Salem County resident, we really appreciate your leadership and even looking at Salem Hospital and seeing, what could be done there. So thank you very much for that.
Well, my colleagues who work here say to me, Mansu, we've done this 3 times before and it never worked. Why do you think that this time it's going to work? I don't know. I got lighting prayers, lighting candles, saying prayers. I don't know. We're doing I think it's the right thing for the community.
Yeah.
I'm not even sure it's the right thing for Inspire, but I'm certain it's the right thing for the community, because we've got to be there. We just have to be. And so many people have tried to do it other ways, and we just haven't made it. And so we've got to do this, and we have to figure it out with the community.
Marcella, give you a good shout out in the chat.
She knows 25 years we've been. It's funny because one of my board members said to me, so we're out of space in Mullica Hill. I know we just opened. It makes no sense, but we're out of space in Mullica Hill. And so one of my board members says to me, like, how could you do this? How could you not know? You would be, you'd be out of space. I was like, we didn't know we were going to get PCI. We've been working on it for 25 years. Why did we think it was going to happen, now? But we'll figure it out.
Yeah, I'll have to reach out. This is the first I heard about it, so I have to reach out to Bob Wise. I mean, he championed that, right? I mean, for a long time.
No.
And unfortunately, he retired at Hunterdon Medical Center before he could see that. But that's a big win for Hunterdon as well.
It's a big win for everybody in the community, that when you can do an elective procedure and be close to home and have that comfort and safety, that's really the exciting part of it. And of course, everybody needs to be assured that whatever level of care you need, you get when you have a process to be able to get you there. And we've done that long, with our docs and participation, but it really is going to be a wonderful addition. I didn't realize that Jen Witt was on. I should have been more careful as a board member. So sorry. Hope I didn't embarrass you, Jen.
Jen?
Any other questions? We've got about 10 minutes to go before we close out.
Yeah, if I can just say, Amy, thank you for what you've done for Rowan College of South Jersey. The foundation met last night. What Amy said about the programs and the $2 million commitment to the colleges was just a brushstroke of what is really going on. Dr. Keating got before us last night and probably gave us 20 minutes of detail over new programs that are coming back to the college, how the money's being split between Cumberland and Gloucester. It's really an incredible commitment. And the other part of it is that through your association with the university, it sounds like we may get more doctors out of this. And we all know there's a doctor shortage as well. So the programs are expanding. The synergy between the college, the university, and Spira and the other healthcare providers in the area is just becoming really amazing. and the transformation that you've made over the last year and a half. It's only been a year and a half, and everybody can see what's going on over at Spira. Just want to congratulate you for that.
Well, I want to thank you for your leadership. I mean, the commitment that the school has made to be able, with Rowan, to put that medical office building on that campus. I know it will be open soon, and that will have a program for children with special need, or for adults with children and adults with special need, the RISE program, as well as give us another training opportunity. And we're just so very excited, and it's all good. Here's the bottom line. We all have to work together to be successful. If I succeed and others fail, then it doesn't work. Or if they succeed and I fail, it doesn't work. We all are essential to the community. And so more so here probably than other places, it really is critical. And being able to have these candid conversations and being able to understand it and work together and understand, we're so thankful for Marlene and the Southern New Jersey Development Council to be able to put us together so you can hear about what we're doing. I was at the Bridgeton Area Chamber, I guess it was just yesterday. Oh my goodness, feels like a million. Yesterday, and they were talking about, they've got a program, I think it's with Sandy, with your guys coming up, talking about all the cannabis work that's going to be coming into the county. And regardless of how you feel about cannabis, it does bring economic development. And Atlantic City Electric is going to make money with the 24-hour running, and you're going to have construction, and all those things are things we need to know about so we all can plan and think about how we do that together. And deal with whatever else is happening. The one thing I didn't probably spend a lot of time on, because I know we were talking about economic development, but you can't talk about economic development without also, talking about some of the challenges. And we've got some issues in reference to post-COVID. The level of violence that we're seeing in our facilities and on the streets is significant. So we have hired a whole group of people that are working with us on workplace violence issues. It has been a concern, especially by our emergency room staff, and just making sure that we're partnering with community leaders on that issue as well. We've been meeting with the superintendents about, are there things that we can be doing to be helpful? And, look, these are tough issues. It's not, it's not an easy thing. And so we're using our available resources to provide whatever expertise is needed. And, in that case, some of that expertise might be involved, how you protect yourself if indeed you find yourself in the middle of gun violence. And our EMT team is thinking about how they would put together that curriculum and help kids know how to be able to be responsive, because they are finding themselves in those situations. So they got to know what to do.
Okay,
Amy,
last call. Any other questions, comments?
Yeah, I have a question. It's Frank Jones. First of all, Amy, thank you for making the time today. I'm sure that you didn't have it in your schedule just to pour it out. So thank you very much. My question is, and I don't know that you're going to be prepared for the answer, is we talk about the expenditures, the investments that healthcare makes. Certainly you've expressed that this morning very clearly about the projects, the changes, the additional location. But we seldom talk about the economic impact, the positive economic impact that comes from the investments and the expenditures. And so with all that Inspira is doing right now, I'm assuming somewhere internally there have been studies, but do you have an idea of what that looks like?
I don't have the answer for you on the ready, Frank, but I know the Hospital Association on an annual basis does the economic impact that hospitals have on their communities, and we can actually drill that down by hospital. I believe I did see this, I saw last year's 2021. Let me get that and I'll send it back through the council, and they can then share that if it's okay. Because we actually have the statewide. It's amazing how much money is invested. And again, not just in the construction part of these equations, but just having people in the community and spending and all those things. So yes, I can get that for you. Thank you for the question. I appreciate it.
Great. Thank you very much.
And I just want to, just do a personal, if I may. Marlene Aselta and I think I met Marlene in 1989 when I was first starting. And, she's one of those individuals who has always been somewhere in my life. If I didn't see her on a regular basis, it didn't matter, because if I needed something, she was always only a phone call away. And I know that it will be hard for guys to understand this, but sometimes it's harder to navigate your way through journeys as a woman. And certainly in that period of time, it was. And I just want to thank Marlene for all of her mentorship, her friendship. She did pull me out of traffic on more than one occasion when I was on a tangent when I was young and full of all that. And Marlene, I'm grateful for your friendship.
On that note, Marlene, thank you very much, Amy. As Frank said, we know you're very busy. Marlene, I'll turn it over to you if you want to say anything, but we're very appreciative, Amy, of your time. Thank you for spending an hour with us. I know Bill, my co-chair, has some closing remarks, but Marlene, I'll turn it over to you.
Well, I can't say too much because Amy put a sort of lump in my throat. And yes, we go back a while. And thank you so much for being with us. And on behalf of my board members, many are on this call right now. We've seen Inspira do such wonderful things in such a short amount of time. And I think it all goes back to August 2020. So thanks. And thank you for taking this invitation. 50 some people have been on this call, and that's highly unusual that we get that kind of response. So a sincere thank you for your time. I will turn this over to Bill Whalen, who is Sam's co-chair, for some concluding remarks.
How do you make concluding remarks after what Amy covered in some concise way? But Amy, it's always great to hear from you and to hear what's going on at Inspira, what's going on sort of in the world around you, because you cover so much ground. So on behalf of the Development Council, I want to say thank you to you. And I want to thank the over 50 participants on this call as well for getting on and for the questions and the participation, but mostly you, Amy, for giving us so much to think about and to consider, because when the Development Council plans these meetings, usually it's Marlene and her staff to get together with the chair or co-chairs of the various committees. In this case, we talked about economic development, we talked about healthcare, who should take the lead, and so we worked together, and you made this whole thing work in accord with how we felt it would come together, because you covered, I mean, I heard Deptford, Woodbury, Mullica Hill, Salem, Williamstown, Vineland, Woolwich, Elmer, and I know I'm missing others, in addition to how we grow medical care, how we keep doctors here who finish residency programs, how we expand EMS, how we consolidate medical practices, but everything in the interest of providing improved healthcare, improved benefit to our population, and at the same time, the economic development that comes from your new capital investments, in addition to the investment being made in current facilities. So you covered all of it so well, and we're so grateful for you, for Inspira, and your leadership has been spectacular. We thank you very, very much, because I go back, Sam talked about Salem and his experience. We raised our family in Upper Deerfield, so we used the bridge to Neora when the kids were young, many nights. And we've been to Vineland, we've been to Elmer, and we really are so grateful for Inspira's presence and the great care that you and your staff provide. So with that, I want to say thank you.
Well, I appreciate that. I really would be remiss. None of this happens without the tremendous, 6,500 employees, but really it's the leadership of the board of directors, right? Your CEO can only be as good and as progressive and as community oriented as that board lets you. And Mr. Rossi and Mr. Galloway, who chairs our network board and our foundation board, and Dr. Bonner chairs our hospital board, are just really great leaders, and we have great board members, and I'm just so honored to be a small part of it, and really grateful to all of you for the warm welcome you've given to me. I didn't know a lot about South Jersey already, but I certainly have been welcomed, and I'm really thankful for that.
Well, thanks again. And with that, I think we can wrap up right on time. Okay, so with that, we'll wish everyone a good day, and we thank you all for being on the call.
Thank you all. Have a good day.